First and foremost, the public space is a fantastic resource available just at our doorstep as a city. Quite often the spaces are used for cars and for greening infrastructure in a way that we cannot use it. So the first and most important point is that we need to redesign the public spaces to cater for public life and healthy lifestyles in the city. Second point today was to showcase that Copenhagen has not always been Copenhagen. A lot of visitors are coming to our city and think that it's so beautiful and we have come so far. But I wanted to show people that we've had industry along our harborfront. We've had parking in many of our squares. We've had lots of transport and traffic in our streets. So change can happen, but we need to work with the culture and the people who need to change their behavior over time. And my last point was really to say that healthy places also needs to accommodate for inclusive process and engagement of people locally, so that places can have memory about the past and point towards the future at the same time. The public space is in fact where everything comes together, but the public sector cannot change the public space by themselves. Neither can the private sector nor the citizens. So we actually have to design our processes of developing the city in new ways to allow for partnerships between organizations, between citizens and private corporations and the city, in order to actually create win-win situations and not just good projects, but shared value for everybody involved. Gale as a practice is focused on building cities for people, and by that we are focusing on making the cities accessible to people, making people visible within the planning process, but also finding ways for people to have a healthy life within cities. Far too many cities are focusing on the built environment or the transport infrastructure or the economic development alone, and we have a tendency to manage our cities in silos. But by putting people at the center and at the forefront of our decision making, we can make a healthier lifestyle and a healthier city at the same time. So a lot of change is happening to our cities these years. Climate is one of the factors that will dramatically change our cities when we look into the future, a decade or 2 or 3 from now. We don't really know how the climate is going to change, but we know for certain that we will have, in some regions, much more rain. In other regions, we will have more drought. We will have the rising of the sea level and migration of a lot of people that are living close to waterfronts as it is right now. So these changes are happening over the next generations in front of us, and we need to start thinking about the redesign of our cities now. And by combining mitigation and adaptation, by putting people at the center of that design process, we can solve those issues by having a people-focused approach. We cannot solve it by focusing on the infrastructure in itself and trying to optimize one system at a time. We have to have a multi-sector approach to solving these complex issues. And the people aspect is actually what is the shared denominator across all of the risks that our cities are facing today. Climate might change, but the one factor that remains is the scale and the size and the needs of people.